Welcome back to Mom and Mind. I'm your host, Dr. Kat. Thank you so much for being here with me today. We are going to be hearing from licensed professional counselor Lindsay Harris, and she's sharing her story of having a pretty decent pregnancy that ended up in an emergency hysterectomy. I think this is an important story for us to be hearing and to be sharing here on this podcast. And I'm really grateful that she is sharing with us today. I think there are a lot of people out there who have this experience and may end up feeling very alone, dealing with a lot of grief, dealing with trauma, and not have maybe a ton of people in their immediate circle to be able to talk to about this, or hear that it's happening to other people. So I'm grateful that Lindsay is sharing with us today. She is a mental health therapist based in Princeton, Texas. And while she specializes in treating eating disorders, anxiety, and depression, she also brings a deeply personal perspective to mental health conversations. After experiencing postpartum depression and birth trauma firsthand, she's become a passionate advocate for maternal mental health and the importance of seeking support during life's most vulnerable moments. So let's hear from Lindsay. Welcome, Lindsay. Thank you for being here.
Thank you so much for having me.
I'm grateful that you're coming on to share some of your personal story with us today and some of the professional work you're doing now to help others. So I'd like to invite you to start wherever you'd like, with your story.
Yeah. So I am a licensed professional counselor here in Texas. And so, mental health is my passion, but also my career. And in, I guess around January of 2023, I got pregnant with my first pregnancy. And so very excited and, didn't have a lot of expectations, obviously, of what pregnancy was going to be like.
Mm-hmm.
But I was very, there was some nerves there about just like, how I would handle sort of the chaos and the unknowns of pregnancy. So I had a lot of open conversations with my doctor about, you know, my mental health struggles in the past, struggling with depression and anxiety, and made the decision to continue to stay on my medication through
Mm-hmm.
pregnancy. And so, yeah, my pregnancy was pretty calm. Well, I mean, I don't have anything to compare it to, but it was pretty mild, and it was, an exciting time. I was excited to meet my daughter, and yeah, so you know, we kind of got up to the point of her due date, and yeah, things were kind of just going very, I guess, normally, as
Mm-hmm.
um, and yeah, so going into, I guess I should say for background, at that time I was a therapist in a hospital. So I worked on an inpatient unit for eating disorders.
Mm-hmm.
And the hospital has always been a very, um, um, I don't know, I've never had any bad experiences at hospitals. And so I really enjoy my time at hospital.
Mm-hmm.
It kind of
Mm-hmm.
felt, it wasn't something scary. So when it
Mm-hmm.
came up to the time of my delivery, going into the hospital, it just felt, I mostly felt excited,
Mm-hmm. Mm-hmm.
and so I went in, and I had, throughout the whole process, a really wonderful care team. Both my mom and sister are nurses. And so I have a special place in my heart for
Mm-hmm.
nurses, and definitely a special place for the nurses that were with me through my time. But yeah, I ended up, it was 40 weeks exactly when I went in.
Mm-hmm.
And again, I was trying to really hold like loose expectations of what the
Yeah.
delivery experience was going to be like. And so, um, yeah, I was, at the beginning, we kind of were thinking, okay, this is going to be, a vaginal delivery.
Mm-hmm.
And so I was, um, grateful that I was able to experience like pushing but it ended up, the pushing, there was just not a lot of progress.
Mm-hmm.
Um,
How long
it,
was that? How long did that go on?
yeah, I think I pushed maybe like 3.5 hours or
Mm-hmm.
so.
Mm-hmm.
Um, and I know the nurses were really, sort of wondering like, okay, why isn't why isn't the baby like, progressing more?
Mm-hmm.
So it seemed like there was some sort of like there was going to be some sort of difficulty, I think, delivering vaginally. So my my doctor came in and talked to me and said, I think just for the safety of you and the baby, we need to move forward with a C-section. Um, and at that point, I was pretty exhausted from pushing. So
Mm-hmm.
I felt a lot of relief. I was like,
Mm-hmm.
okay, I get
Mm-hmm.
to meet her. I'm so
Mm-hmm.
excited. And again, I felt pretty calm.
Mm-hmm.
Um, and so we moved into the OR, and again, the care team, everyone was just so wonderful. And I'll speak to this more, but I think just a very trauma responsive team, just very, I don't know the words, just calm, very understanding, very empathetic, and helpful in explaining
That's
things,
great.
explaining the process. Yeah, I was really grateful for that. So the C-section, uh, seems like it went quickly, and my daughter Hannah was born, and she was healthy and strong, and yeah, and so after that, everything looked fine, and my husband and I and Hannah were moved into the recovery quarter,
Mm-hmm.
the little section right before you go to your room, your
Yeah.
recovery
Yeah.
room. Um, and at that point, I hadn't held her yet. And so I was like, oh, like, I want to hold her. Um, and so my husband handed her to me. And at almost the exact second that I was holding her, I started feeling really sleepy
Mm-hmm.
and almost like I couldn't keep my eyes open. And so I told him, I said, hey, like, it's probably the anesthesia. Can you take her, or some sort
Mm-hmm.
of medication? I'm
Mm-hmm.
feeling sleepy. So he took her. Um, and nurses were continuing to check me. And then one nurse, I could just tell on her face like something was wrong.
Mm-hmm.
Um, and so she, I was like, I could hear kind of what she was saying, and she was taking like one of the chuck pads and weighing it to see how much like I was bleeding, which is usual, but I guess she was nervous about the amount of blood.
Mm-hmm.
Um, and so after that, they were checking, more nurses came, um, and it was the calm atmosphere just completely disappeared. It was, um, they were like, hey, we're going to have to bring you back in to the OR.
Mm.
Um,
This is how
it,
long, how long of a period of time after your daughter came out until
mm-hmm.
this part of your experience?
Yeah. I mean, the timeline is a little fuzzy, but I don't think it was long. I think
Mm-hmm.
maybe like 10 minutes, maybe
Oh,
not even.
oh, okay.
It was very quick. Yeah. So we got set up in the little area.
Mm-hmm.
I held her for a second, handed her back to my husband, and then all this kind of started going on.
Mm-hmm.
Um, so my husband was standing there with our daughter, and they wheeled me back into the OR.
At that
And
point, did they give you any information as to why?
they said, hey, you're bleeding,
Mm-hmm.
and we need to go back into the OR and reassess, and see what we need to do to get this stopped.
Okay.
Um, and so I went back in the OR, and there was a lot of people in there, and a lot of bags of blood in there as
Mm.
well. And so that was very, felt very scary. I had some of the same team members. So my anesthesiologist was the same person. And I remember he like had his hand on my shoulder and he was like, like, hey, it's me, like, you're okay. Um, and, but there was one point where, I turned to the nurse that was on my right and I was like, am I going to die?
Mm.
Like
Well,
it just,
that's yeah. I mean, it's such a quick swing from one experience to the next.
yeah.
So different from calm to worrying about dying. Ooh.
Mm-hmm. Yeah. It was very jarring. And my doctor came in and she talked to me before I went under and she said, hey, Lindsay, here's what's going on. Like, you're having uterine atony, so your uterus isn't contracting back like it should.
Mm.
And so there's a few things that we can do, that we can try. But if none of those things work, we're going to have to do a hysterectomy.
Mm.
And so I looked at her and I was like, okay, like, what do you say? I was like,
Yeah.
I trust you. And I mean, my doctor is amazing and she's just a wonderful person and just an amazing provider and doctor. And so I did feel like I knew that she was the best person to be in that room
Mm-hmm.
doing that surgery at that
Mm-hmm.
point. But yeah, that's sort of my last memory before,
Right. So you're going
waking up.
under not
Mm-hmm.
knowing what the outcome's going to be really.
Right.
Mm-hmm.
Yes. Yeah. Because there was potential that there could be other like stitches or different
Mm-hmm.
medications that
Mm-hmm.
could have helped the uterus contract.
Mm-hmm.
Mm-hmm. Mm-hmm.
Okay. Did your husband know what was going on at that point?
Um, so they were talking to him and letting him know. And he, um, at that point, he was very alarmed, obviously, and scared. So he called my my parents and his parents to come to the hospital to be
Mm-hmm.
with him.
Mm-hmm.
And my dad is actually a physician,
Mm-hmm.
so um, I think that was probably most difficult for him because I think he knew the risk, you
Right.
know.
Right. Yeah, for
He's a
sure.
surgeon and I think all the words and things that were being said, he understood what
Yikes.
the risk was.
Yeah. 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 Yeah.
Um, so, but again, the care team, my whole team, just the communication, at that point with Hannah, it would have been time for her to she's getting hungry, right? She's, you
Mm-hmm.
know, so there were decisions that needed to be made about
Right.
that.
Right.
And so the nursing team, I mean, just phenomenal, letting my husband know, like, hey, here are the options. There's
Mm-hmm.
formula, we have donor milk,
Mm-hmm.
like what helping him kind of make that decision.
Yeah.
And so, yeah, being able to, he was able to make decisions that he really didn't plan on having to
Mm-hmm.
make.
Right. Right. Wow. It's just such a 180. Okay.
Mm-hmm. Mm-hmm. Yeah.
All right. Okay. So you're in the operating room, your husband's with your daughter, family came,
Mm-hmm.
and then what?
Yeah. So I woke up and I was in the ICU. Um, and the first thing I remember is looking at the clock and it said like 4:15 or 4:20. And I had delivered Hannah at like 9 p.m. So I thought that it was like 4:15 in the morning. Like it had just, only a few
Mm-hmm.
hours had passed. It was the afternoon. So it had quite a
Mm-hmm.
lot of time had passed. At that point, I was intubated, so I couldn't talk.
Right.
But my family was in there with me. Um, and, again, that's, I'm definitely a person who likes to be in control,
Mm-hmm. Mm-hmm.
who likes to know what's happening, that has a plan for everything. And so for this to just sort of be laying there, not able to ask questions,
Mm-hmm.
that was really difficult. But I will say, like, the team was very, really good at, like, explaining things like, hey, you have this tube in, we're going to, it'll only be in for a few more hours. We're checking things. We're going to get it removed, like kind of telling me what's going on. And then, my mom and dad were there too, kind of just for support. And
Right.
my husband was with our daughter upstairs in the room.
Mm-hmm. Mm-hmm.
So I was separated from her for about 2 days, I guess.
Wow. Wow.
Mm-hmm.
Okay. So like not even able to see her.
They brought her down once they pulled the tube out, and
Mm-hmm.
I was a little more stable to
Mm-hmm.
where I could hold her and do some skin to skin, but it
Mm-hmm.
wasn't that whole first day I didn't see her.
Right.
And I think it was later the next day that I was
Wow.
finally able to hold her.
Right. Okay. Okay. So at what point did you find out what happened during surgery?
Mm-hmm. Yeah. Yeah. Once I was able, I don't know the medical term for when they take the tube out, but once that happened, um, my mom was right there. And so I asked her, I said, did I have to have a hysterectomy? And she said yes. Um, and I, I don't think at that point I was so glad to be alive.
Hmm.
I think there was sadness, but I think mostly I was just like, okay, like it just felt so surreal and so
Right.
like an out of body experience.
Right. Right.
And so at that point, I felt very grateful to be alive and to know that. I think what really got me through was knowing that Hannah was strong,
Mm-hmm.
and she was with my husband. So I don't think the emotions about the hysterectomy hit me fully until getting home from the hospital.
Mm-hmm. Mm-hmm.
But yeah, I found out in that moment, when I asked my mom.
Um, okay. So, right. I mean, you're still also uh, under whatever influence is left of the medications in your system and
Mhm.
exhaustion of some
Mhm.
type of or another or many.
Mhm.
So, how long um, were you in the ICU
About 2 days.
post surgery?
And then I was moved up to room with my daughter,
Mm.
and we were there for maybe 5 or 6 more days,
Oh, wow.
while I was recovering. Mhm.
Okay. So it's quite a bit of time. So
Mhm.
with the procedure that you had at
Mhm.
what were you able or not able to do? Like walking, standing, holding your
Mhm.
daughter, like what
Mhm.
were your kind of limitations?
Yeah, honestly, I once I was moved up to the room, I mean, I was able to hold her the second day in the ICU. She was able to come down, and I was able to hold her. I had nurses coming down helping collect colostrum,
Mm.
um, bringing pumps. Really, just they knew I wanted to at least try to breastfeed, so they were really trying to make that happen for me, which was really, really sweet. They were very kind. But yeah, I, I think I was able to walk maybe, um, it was a couple of days after I'd moved up to the room with her.
Mhm.
But I was able to start pumping and working on breastfeeding with her, trying to, get her to latch because she had
Mm.
been getting a bottle for the
Right.
first bits of her life. So that was something that, the lactation consultants were helping me with.
Yeah.
And, but honestly, that physical recovery part was not, it wasn't, I mean, it was painful, but I think, yeah, the physical therapist and everything, they really, again, with that like trauma responsive, they knew like, hey, you want to be able to sit up and hold your daughter. You want to be able to
Mm-hmm.
get, you know, get moving.
Mm-hmm.
That's your goal, and we're going to help you do that as safely as possible. So helping me
Nice.
learn how to get up from the bed, and
Mm-hmm.
really encouraging me to stand up and walk if I could, and
Mm-hmm.
just really helping me to help progress the healing process and to get me out of bed so I could, be able to be more involved,
Yeah.
with
Yeah.
diaper changes and things.
Okay. So mentally, emotionally, what's happening during this time from like coming out of,
Hmm.
well, at any point along the way?
Hmm. Yeah. Again, I think there was a bit of a daze kind of the whole time I was in the hospital. I did meet with a psychologist that came and met with me maybe on like day 4 or 5 that we were in the hospital. So kind of middle towards the end.
Mm-hmm.
And she just was checking on me, but also really encouraging me to, make sure that I have therapy lined up, trauma specific therapy, EMDR, something
Oh,
along those lines. And she specialized she was, she had a private practice, but she did part-time consulted at the hospital. So again, the where I delivered, I every step of the way, I feel like they were really on top of things.
yeah. I like don't, I rarely hear how on top of it sounds like these providers and the system was,
Yeah, that's
sadly.
why, the term trauma informed, like they were trauma responsive. They were responding in the moment, and they were really, um I mean, I was just blown away by how, sensitive they were, and just,
Yeah.
and I think unfortunately in a bigger hospital like this, they probably, these nurses and these PTs and lactation consultants see these types of, really traumatic deliveries
Mm-hmm.
and stillbirths and
Mm-hmm.
things like that. And so they are very, responsive and knowing like, okay, this is what we need to do.
Right. Right.
But yeah, I'm very grateful to them.
Yeah. Yeah. Okay. So, this therapist was
Hmm.
suggesting therapy, trauma therapy,
Hmm.
EMDR, all of that.
Hmm. Hmm.
At that point, did you think that, oh yeah, I'm definitely going to need that? Or were you still in this kind of just coming out of the fog?
I I was, you know, um I've had therapy on and off, since I was a teenager. And so I knew postpartum is a difficult time, and then I knew on top of this. So I don't think there was really any, like, oh, should I or shouldn't I? It
Mm-hmm.
was sort of a definite like, yes, I know I need to
Mm-hmm.
get on that. But again, that's sort of something else to add to the list of, you know,
Yeah. Right. Right. Lots
um
to do.
mhm,
Okay. So once you said once you got home, you started
mhm,
feeling the
mhm,
more of the emotional heaviness.
mhm, mhm.
What was going on then?
Yeah, I think coming home, reality set in. And of course, postpartum is a very difficult time. It doesn't matter what your delivery is like, it's
Mm-hmm.
difficult. The hormones, the adjustment, the lack of sleep, physical healing, mental adjustment. You have this newborn baby. And for me, I just noticed there would just be these waves of really intense grief about, and sort of this like ruminating on the fact that, okay, this is I'm never going to be pregnant again. And this is my only, potentially my only newborn, you
Mm-hmm.
know. and so I just kept, it almost felt like you have to be grateful and savor every moment, but those moments were really hard.
Yeah.
And so I was trying to adjust to being a new mom and, feedings and everything. And also feeling like you need to be grateful. You need to just, this is the last time, so it was a lot of just kind of conflicting feelings. And I could definitely tell that I was, shifting. I was getting depressed.
Mm.
And, so I was I was doing therapy, and I ended up reaching out to my psychiatrist, and having some medication changes.
Mm-hmm.
And again, advocating for myself, like, hey, I wanna continue to try to breastfeed, but I'm also, I want to be mentally well. And so, um, I was, again, I think advocating for yourself and knowing, you know, I know you've had
Yeah.
people on the show before talking about what the research shows
Mm-hmm.
about, staying on your different medications.
Mm-hmm.
And so, yeah, I ended up, getting, a change in my medication to help me. And then, my therapist, as we kind of worked through, um, everything, I kind of, it became apparent that I was also having a lot of PTSD and triggering,
Sure.
a lot of memories, and like feeling very triggered,
Yeah.
through difficult things. So, yeah, so that was my maternity leave was, about 20 weeks, and it was a rough 20 weeks.
Mm-hmm. Right. So like you said, physically healing was, okay, but
Mm-hmm.
the mental, emotional, the psychological impact of all of this is
Mm-hmm.
right. You're not only adjusting to being a new mom, but this idea that whatever hopes or thoughts you had about what your
Mm-hmm.
family would look like are
Mm-hmm.
now pretty different.
Mm-hmm. Mm-hmm.
So it's
Yeah.
a lot of change.
Yeah, it was a lot of change. And yeah, as somebody who I change is difficult for me, yeah, it was really hard.
Mm-hmm. So what was your healing process like in terms of the trauma recovery? How
Mm-hmm.
long did it take for you to feel like you were kind of coming out of that space of being triggered and or
Mm-hmm.
as often anyways?
Mm-hmm. Yeah.
um,
Yeah, so in therapy, I did EMDR, for my trauma, and so, it's very structured. So there was a lot of, as much as we want things to just, one and done, oh, I'm fixed, oh, things are
mm,
better now. It is a process. Um, and so I think, it took a few months of um, EMDR therapy, and then when I returned to work, that was another adjustment that kind of, I had a little bit of a step back
mm,
from. um, and so continuing therapy, and I mean, right now, um, I'm about 14 months um, post delivery, and so I feel like I'm in a much better place.
mhm,
But there are still hard days, my daughter's first birthday,
mm,
so I think it's very similar to, as therapists, how we talk about grief,
mhm.
right?
Yeah.
Of the waves, and you can kind of be okay and feel like it's managed, and then something kind of comes up and you get hit with another wave.
Right.
So,
Right.
um, but I think it's, you know, weekly therapy was really important for me, and being, advocating for myself and what I needed.
Yeah.
And that ended up being, not staying at my current job,
Mm,
um, which was in a hospital setting, which, going back, I didn't realize that would be triggering.
Right. Was it the same
So
hospital that you worked in?
no,
Oh, okay.
no, different hospital.
Mhm.
Yeah. So I worked in a pediatric hospital. And that was really hard because that felt like I was having to say goodbye to this dream and these wonderful coworkers. And, um, but I knew, and also kind of, yeah, I think it was the right decision, but it was really a hard decision to make, to focus on what's going to be best
Right.
for myself and for
Yeah.
my daughter too.
Right. So you transitioned out of hospital work altogether?
Yes.
Mm-hmm.
Yes. So I decided to leave the hospital and to go into private practice. And before all this, I think I imagined I would be in the hospital my whole career. I mean, the hospital setting, it's such a special place. The team, the collaboration I mean, it was an amazing environment. But, I would tell my coworkers, I was like, I'm not the same person I was when I left
Mm-hmm.
for maternity leave.
Right.
And so, you know, making the decision, that was really hard, but it was the right decision for me.
Yeah. Did your experience at all change the specialty that you're interested in helping? Like working with eating disorders? Um,
Um, yeah, I mean, I think my experience as a mom, being pregnant, so when I was pregnant, working on an eating disorder unit, that was a very interesting experience. Um, I think um, many pregnant people can probably, you know, you get a lot of comments about how your body looks.
mhm.
And I will say, like, I
Just in
always
general, you mean like at work, but uh, everywhere.
right everywhere. You're
Mhm.
out and about, you're in the grocery store, a
Mhm.
stranger just says something, yo, you look like you're about to pop, or, just comments.
Yeah.
And I will say, I always like to think the best in people. Like, people aren't saying those things maliciously,
Hmm.
but you know, I would notice people commenting on my body. And there was a time at work when I was with one of my patients, and somebody commented on my body. And so then we had to spend the whole rest of the session kind of processing, okay, what the reality is that we do live in a world where people do comment on how you look.
Hmm.
And so I think I guess I just became a little more sensitive to noticing how people talked about pregnant women's bodies,
Right. Right.
both pregnant and postpartum,
Hmm.
and just hearing more stories of people, getting comments made, and how that really impacted them. And then if someone has been struggling with body image issues in the past or is
Hmm.
currently,
Hmm.
that's really difficult. And so that's something, like when I went to my doctor during my appointment leading up to the delivery, I told her, I said, I don't weigh myself at home. I don't know my weight. You let me know if that's something that you need to bring to my attention. But, as far as I'm concerned, you record that and I don't need to know
Hmm.
my weight.
Right.
And my doctor was, very on board with that. But for someone who doesn't know to ask that,
Yeah.
they get their weight kind of sometimes just, okay, this is what you weigh today. And
Yeah.
it can be really hard.
Yeah, definitely. So the work you were doing with eating disorders is now kind of integrated into pregnancy and postpartum as well.
Yeah, I think I knew when I was kind of leaving the hospital that I wanted to be able to bring in like my experience with postpartum and pregnancy. I think I want to be very sensitive and aware of, like, I wanted to make sure I'm healing first.
Hmm.
So,
Hmm.
but yeah, my hope is that in the future, I'm really passionate about, you know, helping people advocate for themselves in the
Hmm.
healthcare system,
Hmm. Yeah. Yeah.
and so, and just pregnant or not, but especially in pregnancy,
Yeah.
and helping doctors kind of understand how they can, I know you in the past you've had some dietitian come on of
Mm-hmm.
like, screening for eating disorder
Mm-hmm.
behavior during
Mm-hmm.
those visits, things like that, sometimes we don't think about.
Yeah, so much work still needs to be done
Mm-hmm.
in that area. Um, Kind of where eating disorders, body image, disordered eating intersect with pregnancy, postpartum,
Mm-hmm.
reproductive, everything, even from
Yes.
for fertility and IVF all the way through.
Mm-hmm.
Um, yeah, there's just so much more work that needs to be done. I mean, it sounds like you know how lucky you were to have such a supportive,
Mm-hmm.
trauma responsive team. And you also know from all the stories you hear that that doesn't always happen.
Mm-hmm.
People aren't always getting that kind of understanding and compassion and empathy, for sure. But as you were talking about it, like I mean, this is just theoretical at this point, but had you not had that type of team, the potential for your situation to have been so much worse. Um, for not, I mean, you didn't have to deal with the trauma of the people trying to help, like who are supporting you. Um,
Mm-hmm.
and how much of a difference it makes. And not I'm not minimizing at all in any way your experience. I was just thinking like, oh my gosh, it could have, if the people around you hadn't been the way that they were, how much
Mm-hmm.
worse that could have been.
Mm-hmm. Yeah. And that's where I think, healthcare professionals that are enduring this trauma every day, that's something else that's I'm very passionate about is, their mental well-being too.
Totally.
They are really on the front lines, and coming out of COVID, they have been in this, I think, chronic state of fight or flight, this
No doubt.
stress, seeing these trauma. So I am so grateful to that team. And
Mm-hmm.
yeah, I think I'm just very grateful, and the fact that I think they're just exemplary example of,
Mm-hmm.
yeah, being trauma responsive and just
Yeah,
in
that's how it
every
should
way.
be.
Yeah. Mm-hmm.
Ideally, but to your point, right, it's not, the systems have to change to support
Yes.
the providers better,
Yes.
for sure.
Mm-hmm.
um and even with a supportive team, I mean, I think in some ways sometimes we think, oh, like if you just have the right help, like nothing bad will happen or everything will,
Mm-hmm.
it's it would be great for every place to have, that all of the trauma informed people around, and sometimes things happen still.
Right.
um
Yeah. I think that's where, like PSI, think resources, organizations that are really fighting for, changes,
mhm,
and
mhm.
in the mental health, and in the maternal mental health world. I think that's where it's, finding support, and being having people be so open about their own challenges and struggles, so that
Yeah,
people don't feel alone, or don't feel like, I'm going crazy, or I need to just be able to just get through this, you know.
absolutely, absolutely.
I think my message, and something I always want to bring to people who are struggling, is hope. Like
Mhm,
there is hope.
mhm.
Um and knowing that you're not alone. Um and I think it's it's really hard to go through those dark times, but
Yeah.
I think, yeah, knowing that it's okay to speak up for yourself, and to get the help you need,
Mhm.
whether that's therapy, medication, and yeah, just making sure that you're taking care of yourself.
Yeah, absolutely. It's totally worthwhile.
Mm-hmm.
Um, right. People don't have to just white knuckle it and hope for the
Mm-hmm.
best. There is good help out there and good support out there for sure.
Mm-hmm. Mm-hmm.
Well, I thank you so much for sharing your story. I think it's an important one because there are people out there who've had this experience,
Mm-hmm.
of the specifically emergency hysterectomy, and
Mm-hmm.
um, who who need to know that they're not alone. You know how
Mm-hmm.
lonely it can feel like to be in that grief and that trauma and feel like, you know, you don't have people around you who like get it because they've been through it, kind of getting it.
Mm-hmm. Mm-hmm.
Um, so I really appreciate you sharing your experience with us.
Yeah, yeah. Thank you so much for giving me the space and for all the work you do. I think,
Mhm.
this podcast is just an example, right, of being able to hear stories and resources and
Yep,
to just, yeah, to be able to have that hope and just to know like, okay, this is things can get better and I'm not alone.
absolutely. Thank you so much for being here.
Thank you.
You can connect with Lindsay at Born Counseling on Instagram. And if you haven't yet joined us on the Mom in Mind Instagram page, go give us a follow over there. And do make sure you share these episodes, share the posts from social media. The more people who know that stories like Lindsay's are real and they happen, and that people do make it through and can get the help that they need to feel better, the more hope we can provide and put out there into the world so that people don't have to feel so alone in their struggles. Thank you again for being here with me. Until next time.